Hi, I'm Dr. Ron Miller, and this is Dr. Trey Martin of Pursuit Physical Therapy. And today we're going to go over 5 tips that you can do to help decrease throwing injuries in overhead athletes. So whatever sport, whether it's baseball, softball, football, quarterback, javelin thrower, volleyball, we're going to go over 5 tips that you can do and focus on to help prevent shoulder injuries or throwing injuries from occurring. So Dr. Martin, what is tip 1?
Well, don't forget about our discus throwers too. They're very important
yes.
to our community of overhead throwing athletes. So tip 1 is going to be one of the most obvious tips, but something people miss is maintaining overhead mobility. So what I mean by overhead mobility, I mean that to decrease throwing injury, you need to have full range of motion all the way above, and you also need to have full external rotation, and you want your internal rotation and external rotation to be equivalent side to side. The total arc of that, so we can get into that a little bit more in detail at some other time. But that's going to be tip 1, maintain overhead mobility. You want soft tissue to be clear, and you want to be able to achieve full range of motion, and that's going to help your mechanics and help things during your throw not cause as much injury, because if you have limitations in range of motion, we've seen in research that for every 1 degree you lose of shoulder flexion, which is this overhead motion here, you have a 7% increase in throwing arm injuries at the elbow. And then we also see for every 1 degree you lose in external rotation, which is this way, you also have a 9% increase in elbow injury risk. So that's going to be tip number 1, maintain your range of motion over the course of the season.
Perfect. Keep full range of motion, full flexibility, full mobility, whatever you want to call it. Mm-hmm. That's step 1. What's step 2?
Step 2 is strength. So strength is probably as important as range of motion. A lot of range of motion without strength is not very good. So you're going to want to do your rotator cuff exercises. And then also too, one of the hidden gems is you want a lot of lower body strength. Look at the pictures these days and you see guys like Aroldis Chapman and Syndergaard, who just went on the DL again. Bad example. Forget about Syndergaard. But these other guys, you see their leg strength, and that's going to be a huge component of velocity, but it's also going to help decrease some of the load on the arm if we can get good quality leg drive. So maintain really high quality rotator cuff strength, do your shoulder dumbbell exercises, and get really jacked shoulders, a lot of arm strength there. And then also too, you want to think about elbow flexion strength, and by that I mean biceps. I think a lot of times we don't think about like biceps curls in baseball, but things like chin-ups and bicep curls are going to help actually build elbow strength. And then also we want to look at attacking the wrist flexors. So your wrist flexor bundle goes right above your UCL and helps your wrist do this motion here. That, and then your pronating muscle, which is going to be backwards for you guys, those are going to be important muscle groups to attack. That's going to help offload strain in the UCL. It's also going to make you a better throwing athlete and cause less pain over the course of the season if you have good quality muscle. That's going to take off some of the pressure. So the importance of strength too, we have passive stabilizing structures. Those are going to be like our ligaments, like our UCL. And then we have active stabilizing structures like our muscles. So the stronger our muscles can be, the less strain we put on our passive structures like our UCL. So that's going to be huge for injury risk.
Okay, so step 2 or tip 2 is going to be strength, and not only just rotator cuff and arm strength, but also don't forget about those legs. What is tip 3 to help prevent a shoulder or throwing injury?
So tip 3 is going to be your throwing mechanics. I'm not a trained pitching coach, but there are some common things we see where you see a lot of lead leg knee flexion, meaning your knee is bent too far, that causes arm injuries. We also see mechanics, you have your elbow too inside close to the ear, inside 90 too far or too far out. We see kind of a spectrum there too. So these are going to be things that your pitching coach is probably going to be able to address if you have a really high quality performance pitching coach, but your mechanics are going to lead to where you transmit force. So one of the common things we see, and this is really generic here, but the more overhead you throw, so more up top here, you see a lot of times more shoulder issues, and the more out to the side, you may see more like elbow from like a 3/4 slot. This is not an end-all be-all, but point being, how you throw can impact where you get force in your arm. So really clean, efficient mechanics that utilize your lower body to transmit the power from your legs, instead of getting all the force from your arm, is going to help also lessen and decrease injury risk.
Perfect. So, I mean, that goes true with any sport, really. Overhead
Yeah.
athletes, baseball, even golf. Some of our golfers that we see are also. So, biomechanics is the next one. Number 3. What is number 4?
So number 4 is going to be pitch counts. One of the things we're starting to get privy to is we see a lot of year-round baseball now. So we really need to load our athletes smarter. If you're 10 years old and you're throwing 80 pitches on Monday, and then you're playing shortstop for the 3 games the rest of the tournament, and then you're throwing another 80 pitches on Thursday, that's going to be too much load at this stage. So we really need to get smarter about not only training our load in the off season to an appropriate level, but maintaining lower pitch counts at a younger age. I liken it to weightlifting here. Like, you don't really want your 10-year-old trying to squat 400 pounds. You need to build them up gradually. So we see these youth throwing athletes throwing 100 pitches just to win the Little League World Series. Well, the Little League World Series doesn't get you a signed contract. So I think sometimes we put too much focus on winning that tournament when we're 12, 14, 18, instead of the long-term picture, which is goals like college or pro baseball. So I remember Garrett Cole, who's one of the best in the game right now. His parents were huge proponents of this, and I remember reading an article about him a few months ago where they were having him pick and choose when to throw. So he was not just abusing his arm, a really talented guy. So I think it's really important to pick out the key tournament dates throughout the year. So whether it be a showcase with a bunch of college scouts, or you really want to peak for your high school state tournament, or you really want to peak for a recruiting visit, you want to schedule your pitching around that. Funny enough, a quick story here, my brother actually threw in a game the day before he went on a college recruiting visit, and he normally, he's a mid-80s thrower at this time. He goes to this recruiting visit and he's throwing 78, obviously to say he didn't get a scholarship from that visit. So it's really important to choose when you want to look your best and be fresh for that. So we need to really focus on pitch counts and really limiting how many throws you have.
Yeah.
I love baseball, but throwing is not necessarily a natural motion. We can lessen injury risk, but throwing is kind of bad for you if you think about it. So we need to really be cognizant of how much load we're putting through our throwing arms and don't abuse our arms as much as we have been.
Yeah, overtraining and pitch counts, that's a huge topic right now, especially with teenage throwers and baseball players and stuff like that. That's a huge topic. We could create a whole other video on that one.
Yeah.
But, with any athlete, managing the workload, especially coming back from an injury, but managing the workload to help prevent injuries so you can optimize performance, that's going to be tip 4, which is going to be your pitch count, your workload, preventing overload from actual occurring.
I think another sneaky thing too that I like he said, we could talk about this forever, but one of the other sneaky things that people don't think about is they only think about in-game pitch counts. But I see pitchers all the time when I was in college who would throw 3 pins during the week, and that's also another 60 pitches a pin and a bullpen session, that is, and then they throw an extra 200 pitches a week. And then people also don't really know how to equate yet. There's a difference between pitches under duress, meaning when the bases are loaded and there's 2 outs in the 7th inning or the 9th inning, whatever level you're at the end of the game. There's a lot more stress there in those pitches, and those pitches are going to count more from a arm perspective, from a brain and psychological perspective. So I think that's another thing to add in too, is it's really hard to just quantify pitch count. You really got to start thinking about, okay, am I throwing too much during the week for bullpens? You're not going to forget how to hit the strike zone if you don't throw between starts. Actually, Bartolo Colon is famous for that. He's 43 now, still pitching down in the Dominican somewhere. So Bartolo Colon would not throw mid-game bullpens, and he was always really healthy. He was a workhorse on the mound. So I think those are important things to think about, is not to overthrow bullpens, really calculate, did I have a stressful game? Did I throw a lot of stress pitches? And then also modifying our load management and risk stratification with things like that.
Okay, perfect. What is step 5 or tip 5?
Tip 5 is something I think we miss a lot, and that's going to be thoracic spine rotation and mobility. So I call this one my secret tip because I don't see even people that are really good in the baseball industry attacking this. So with thoracic rotation, we're talking about how much our shoulders can rotate. So this tip is going to be a double-edged sword here. So if we can rotate optimally back here, then our arm can kind of go with it, and So not only are we going to get a reduction in shoulder strain and elbow strain with this increase in thoracic rotation, we're also going to be able to, if we gain this rotation and strengthen this position, we're also going to increase velocity, because the more you can rotate, the more leg drive you can get, the more velocity you're going to get too. So that's one of the huge things we see is a correlation of velocity, is how much disassociation you can get from your trunk to your hips. So the easy way to think about that, if you think of a really talented dancer, that this is not me, so I can't showcase this.
Definitely not
you. Yeah. So if you think about your hips and your torso like this, if you can get your thoracic spine to oppose your hips, well, now you have a coil here, and you're going to be able to transmit that power, and that's going to lead to an increase in velocity. But it's also going to be very protective from an injury standpoint, because you're not hanging your shoulder out to dry by not being able to rotate fully back, and you're not going to have to compensate by getting extra layback from your shoulder. So that's a kind of hidden tip that we've kind of come up on, is something that's really crucial to work on for baseball guys that most people aren't working on.
Yeah. I love that concept, because a lot of people miss this and they just think, oh, shoulder pain, shoulder injuries, and they just treat the shoulder. But there's times that we see athletes who have shoulder pain. All we do is treat the thoracic spine or even the hip, and their shoulder pain goes away. So that's a great one right there, is looking at thoracic spine mobility and how it can help prevent shoulder pain or overhead arm pain from occurring during throwing and stuff. So, we just wanted to go over 5 quick tips real quick that you could go over and review and kind of check off the list and see if you're doing any of these to help prevent any shoulder pain or overhead throwing injuries from occurring. If you have any questions for us, just please put it in the comment box below. I hope you enjoyed this video and it helped you a little bit. I hope that we don't see you, because you guys won't be doing these things then. So in hopes of preventing injuries and throwing injuries and shoulder pain from occurring, implement these 5 tips. If you have questions, you can comment in the comment box below or reach us at pursuittherapy.com. And thanks for tuning in.
Thanks, guys.